Welcome to Iredell NeuroSpine. Meet your surgical team when you have a procedure with Iredell NeuroSpine. Dr. Peter Miller, Whitney Revis, Dr. Miller's physician assistant, Terry Lee, our nurse practitioner, Eddie Ewing, our surgical coordinator, and Kara Kimmett, our clinical nurse coordinator. Before surgery, you will have a pre-operative appointment in the day surgery area. This is also where you come the morning of your procedure. The morning of your procedure, make sure you leave all your jewelry at home. Long hair, please bring a hair tie to put your hair up in, no metal. Wear comfortable clothing to and from the hospital. Make sure you wear non-slip shoes, and also have someone designated to drive you to the hospital and home from the hospital. What to expect the day of surgery. You'll arrive about an hour and a half to 2 hours before your procedure. Staff will collect your belongings and you'll get dressed in the surgical gown. You also will have your IV started and possibly get some perioperative medications. You feel free to use the restroom at any time. You will wait on the stretcher until the OR staff come and get you for your procedure. Now, your family will be notified throughout the procedure of your status and how you're doing by the OR nurse. Before you go to the operating room, you'll see either Dr. Miller's physician assistant Whitney or his nurse practitioner Terry prior to the procedure. Feel free to ask any final questions. And before we actually go back to the OR, you will see Dr. Miller as well. After he has spoken to you, your OR nurse and your CRNA will come get you for the procedure. On the way back to the procedure, just a FYI, a lot of the nurse anesthetists give you a little I don't care medicine as you're rolling back. So sometimes people remember this process and sometimes they don't, but we will not officially go asleep until you get back into the OR. Now, as you roll back to the OR, you'll meet our surgical technician. And this is actually the time they hook you up to the monitors and make sure everything's good to go before we actually drift off to sleep. If you do need a Foley catheter, that'll be placed by the nurse after you go to sleep. In the operating room, depending on your procedure, everyone is positioned differently. However, you may have some redness in the chest or abdomen area or your hip area due to positioning. You could have some swelling in the face. We're giving you IV fluids and keeping you nice and hydrated during the procedure. So a lot of times it causes swelling in the face, so that is normal. You may have certain impressions in your skin due to the position or the equipment we use. Due to positioning needing to be precise, sometimes we use tape to do that. So you might have a little residue left over. Now, before your surgery, you'll have a special soap that you have to wash in. When you get to day surgery, they're going to clean your skin on the area where we're going to operate. And then when you get back into the operating room, we're going to clean your skin as well. And this is all about keeping our infection rate down, and you make sure that you don't have any surgical site infections in the future. Now, once the procedure is all done, we're going to take you to the recovery area. Now, unfortunately, your family can't come back there. This is the time you'll be there for about 45 minutes to an hour. This is just you becoming more aware of your environment as the anesthesia kind of wears off. Once you are safe enough and recovered enough, you'll either go back to day surgery and go home, or you'll be able to go to your hospital room and see your family. After each procedure, Dr. Miller does call your family members or friends or whoever is your designated person for that day and let them know how your procedure went. Now, after surgery, it's a good idea. Obviously, a lot of back surgeries, you can't see your back. To have your family members keep an eye on your incisions. If you can see them, that's great. Just make sure if anything looks yellow, green, or excessive drainage, swelling, redness, or warmth, or if you have severe pain at the incision, you give us a call. Also, if you have a temperature of 101.5 or greater. Now, With that said, like I said, I already mentioned we like to keep our infection rate low, and that's what the washing with the soap and cleaning your skin off helps do, keep that infection rate nice and low. Now, a lot of procedures, you will have a dressing called Dermabond. With this dressing, you can shower about 24 hours after surgery. The good thing about this dressing is your suture is under the skin. This will dissolve. We put a mesh type material over each incision and we glue this on, and that is called Dermabond. Like I said, it's really a nice dressing because you can shower 24 hours after surgery. Don't submerge it in a bathtub, hot tub, pool, lake, anything. When you get out of the shower, don't scrub it. You just pat it dry. And you leave the dressing on in place until your first post-op visit. This is when we will remove it for you. If your dressing is staples or tape or gauze, you can shower after 24 hours. I mean, you can shower 48 hours after surgery, excuse me. If you have dressings with staples or tape or gauze, you may shower 48 hours after surgery. After showering, remove your old dressings, pat the area dry, and put on new dressings over the incision. Don't vigorously scrub any of the dressings, just pat the area dry, and you will need to change your dressings daily. Obviously, when you change your dressings, you need to be washing your hands. Now, restrictions. With any spinal fusion or other procedures other than a spinal cord stimulator, you'll have 8 weeks of restrictions. So spinal cord stimulators have 4 weeks of restrictions. Every other procedure has 8 weeks of restrictions. And those restrictions are no heavy lifting, no more than 5 to 10 pounds, no excessive twisting, stooping, or bending. How long should I wait before returning to weightlifting, sports, or other vigorous exercises such as running? At least 3 months. Now, we will be seeing you for between the 8 weeks and the 3 months. Your first post-op appointment with us will be 10 to 14 days after your procedure. So if you have any questions about what type of activity you can do, feel free to ask us in any of those appointments. You may go upstairs, that is fine. Just take your time, be careful, but you can use the steps. Now, with that being said, we do want you up and moving. That means if you're sitting for longer than 45 minutes at your home, you need to get up, move about your house. Main reason is this: when you sit too long, you get stiff. And after surgery, we don't want you to have increased stiffness or pain. We want you to get up and move, and that will help alleviate that. At least 3 short walks daily, the minimum. If you can do more, that's great. As you feel better throughout your healing process, just make sure you're getting up and moving a little more. You know, flat surfaces, not too far distances. Just make sure you're getting up and walking about the house or to your mailbox and back, whatever works for you as you feel better. Other questions patients have asked: is it okay to use cream or vitamin E oil over the incision? Yes, but this needs to be discussed with your physician assistant or your nurse practitioner at your first post-op appointment. Is it normal to have bruising around the incision? Yes. There are a normal healing process that happens at each incision, and due to the procedure or what we use during the procedure, such as retractors, they might cause slight bruising around the incision. So you will see the normal healing process underneath your dressing, the scabbing or slight bruising, and that will heal as you move along. Now, the next question: what should I do if I'm unable to urinate after surgery? This is not uncommon. It's uncommon. It does happen. If you get home and you feel like you just can't empty your bladder, feel free to give us a call and we'll evaluate it and see what needs to be done from there. Now, the one thing that all patients need to be aware of is that you're getting pain medications, and these pain medications cause post-operative constipation. With that, you need to make sure that you're drinking lots of fluids such as water or prune juice. Again, this is where walking is very good. get up and move. If you want to go to CVS, Walgreens prior to your surgery and have a stool softener at home, once you start taking those pain medications, start taking that stool softener. If that works for you and it doesn't interact with any of your other medications, that is something you're able to do. If there's something you've done in the past that works for you, do that. However, if you just feel like you're trying all these things and they're not working, feel free to give us a call at the office and we'll take it and help you from there. When can I get sun exposure to the operative area? At least 4 to 6 weeks post-operatively. Will I need to go to rehab or physical therapy after surgery? This will be evaluated after your surgery at your post-op appointment. If it's something that you and Dr. Miller or Whitney, Dr. Miller's physician's assistant, or the nurse practitioner, Terry, discuss and feel that that's something you need, we'll discuss that then. But first, we're going to see how you're doing and getting up and moving. How long will swallowing trouble or hoarseness last after not just neck surgery, but all surgery? When you go to sleep, there is a tube being placed down your throat, which causes a scratchy throat after surgery. This is normal. If you are having a cervical procedure with us, it lasts a little longer, that feeling of scratchiness, from a couple of days to a couple of weeks. If you're not having a cervical procedure and it's a normal procedure with us, a couple of days and that scratchy throat should be gone. Water, ice chips, throat lozenges, that'll help that throat feel a little less scratchy. When can I drive? About a week after surgery, when you're not taking any pain medications. I tell everyone, as long as you feel safe enough and it's about a week out and you're not taking your pain medications, you'll be okay to drive. Best place to get your medications filled post-operatively? Any pharmacy is fine. However, just make sure you inform staff prior to your procedure, your pharmacy choice. Now you have 8 weeks of restrictions. Remember that no heavy lifting, bending, twisting. We also have 8 weeks of not taking NSAIDs after a spinal fusion. That's 8 weeks. So example of an NSAID is ibuprofen, Advil, Aleve. They increase your risk of bleeding, and that's something we don't want with spinal fusions. We want a nice, good healing process. With that being said, we're going to be providing you with pain medications, and that's fine. Now, with our spinal cord stimulators and our hemilams and our discectomies, they are 7 days after the procedure. So if you're not having a spinal fusion, you can avoid NSAIDs. Like I said, the ibuprofen, Advil, Aleve for 7 days. If you have had a spinal fusion, that's 8 weeks. Now, with that being said, if you're having a good day and you feel like you don't really need to take a pain medication at that time, feel free to take some Tylenol if you just need a little something to take the edge off. So throughout that process, Tylenol is fine. Now, with our cervical or artificial disc, you will be prescribed medications that do have NSAIDs in that, and that's okay. If you're taking aspirin for all procedures, you may resume that 7 days after the procedures. Now, we don't have any collars or braces for any of our surgical procedures, except for our cervicals that have anterior and posterior. But other than that, there are no collars or braces. Okay, some tips to help you with your recovery process. Make sure you have meals pre-planned or pre-prepared so you're not standing in the kitchen for long hours. Make sure you have a reacher or grabber tool for after surgery. They're fantastic if you drop something and you're home by yourself. Just use your grabber, pick it up, and hand it to yourself. Now, I suggest everyone before surgery kind of go through their regular routine and their daily activities. And if something is too low to the ground that you use every day, make sure you bring that up to the shelf where you can have it more accessible. That way you're not bending or trying to bend so much. We're not saying that you can't move. We want you up and moving. We're just saying, think about it, take your time. This is a healing process for you, and we're going to be here to help you through that process. So thank you for choosing Iredell NeuroSpine for your surgical team and your procedure.